All right, and welcome to another Caveman's Corner. That's Dr. Krol coughing on the mic on the other side right when we started.
I know, this ruined everything right off the bat.
Yeah, so obviously I have Dr. Krol here today. We're going to do a educational podcast probably, or maybe it's just going to turn into a flaming hot pile of poo. But we're going to try and do something pretty entertaining. Almost every combat athlete I know has either neck pain or back pain, so we're going to get into that a little bit.
Cool.
This actually started on Facebook. I posted something that Dr. Krol took a little issue with. Eric Wong, one of the guys, he's a strength and conditioning coach, a flexibility coach. I'm not sure. Dr. Krol knows what he is because he looked him up. Kinesiologist. And he posted that stretching is not the best thing when you have an injury, that you should basically do some core workout. And Dr. Krol took a little umbrage with it. So I'm going to turn it over to you, and we're going to talk about this a little bit.
Go right into it. So, I just want to start out because it's always...
Turn the mic so you can talk into it a little bit. Yeah, there you go.
That's
Yeah, now
better.
you can hear yourself, right?
Yeah,
good.
So one of the things about this is I want to start off just by saying that I have no problem with the individual, and I think the article was written from a place of trying to help. So it wasn't, when you read through the article, it's not like, here's one of the exercises you should be doing, now go check out my YouTube channel for the rest of them, or buy my DVD. So it didn't seem slimy or anything like that. So I didn't have a problem with the intention of the article. I just thought that the rest of the article kind of missed the point and was almost a little irresponsible. So, one of the things that they said was, if you look at it, he says he's a trainer that helps to eliminate pain. And I can't speak for Canadian scope of practice, but I can speak for U.S. scope of practice that, personal trainers and fitness trainers, doesn't matter if you have a master's degree in kinesiology or exercise science, they're not at all to be treating pain in any way, shape, or form independently. So if someone comes into a gym and has legitimate pain, and I'm not talking onset soreness where your back hurts a little bit from last workout or your knee's a little sore or whatever, that they say, I have low back pain, I have neck pain, I have hip pain. You shouldn't be treating that because there's a wide variety of issues that could lead to the symptom of low back pain. It's not a condition, it's a symptom. And he lists that correctly in the article. He says the symptom of low back pain. But there's so many things that can cause that it's a little irresponsible to say, oh yeah, this is what we should be doing. And honestly, trainers should not be independently treating it. If they're working with a chiropractor or a physical therapist or a physiatrist, then it's fine. A physiatrist looks at him and says, okay, it's not an organ issue, it's not something else, it's probably musculoskeletal related, then cool, you can work under that direction. But the first thing you should be doing is going to a medical professional, and the first thing the trainer should be doing is sending you to a medical professional.
Breaking it down, as he wrote the article, though, if you have back pain, should you avoid the static stretching like he was advising in that article?
Static stretching isn't bad. It might be the exact right thing for certain people. So if you look at all the things, and we'll just stay with neuromusculoskeletal, meaning nervous system or bones, joints, muscles, etc., it could be a flexibility problem. It could be a disc problem. It could be a stability problem. It could be a whole bunch of things. So the exercises that he's got listed in there are fine. There's nothing wrong with them if that's the right thing to do. So I always look at stability, and I know we've talked privately about this many times, but stability has to have movement involved. If you can't move, you can't become stable. You just become stiff. So if you take a spine and it's not moving in the first place, then you go through all these stability exercises, well, you've reinforced stiffness. That's one thing that drives me crazy when I'll see PTs walking around a clinic and they'll be like, yeah, you're doing such a good job on that plank, because they're seeing 4 patients an hour, completely unethical, walking around and just quickly checking people. They got some person doing a plank on a plinth 45 degrees and saying, oh yeah, you're doing a great job, your belly's not sagging. And I'm like, their belly can't sag, the spine can't move. So they are stable, which is great in that position, but then they bring that same stiffness to their golf swing, to getting in and out of a car, to reaching for something, for twisting, and it just doesn't work.
So before we get into that, I want to address the first part of what he was saying, that the stretches just mask the pain, that it's not really addressing the issue, so you're more likely to get more injured. Is that true or false, or is that kind of like in between, like everything else in the article? Or
like he talks about the gate control theory of pain, which even the people who came up with the gate control theory of pain have sharply modified it to the neural matrix theory So they don't really even use the gate control theory anymore. It's got some use, but if gate control theory always worked, electric stim would always work. So you can put electric stim pads in your back and it would always work. So basically what the gate control theory in essence says is that the brain can only handle an input from a particular thing at a time. So there's gates that shut on and off signals coming in, and if we give you a different signal, it'll shut this other signal off, and you won't sense nociception, which is not pain, it's threat. So the problem I have with the gate control theory of pain, in essence, is pain is not an input from the body, it's an output from the brain. So, stretching doesn't mask it. If stretching is exactly what you need, then it's perfect for you.
It made sense to me because I remembered when we were working down in your basement doing your practice, and you wrapped that thing around my arm when I was having trouble lifting, and it magically cured my injury with whatever you said.
Yeah, the mobility wrap.
Yeah, and as soon as I read that article, I thought of that mobility wrap right away, and I thought, oh man, maybe this is true. So then I was like, oh, this is kind of like all the stuff we talk about. So I posted it, and I love Facebook because I post stuff, and my friends call me out on all the stuff that's not true, so I really like it. So a lot of times I can just use it as a fact check. I just post it, and I know someone that most of the people I know are really, they're very well educated in their particular fields, and they take it very personally. So when I post stuff, someone's always going to post on there and let me know what the truth is, and I really like that. I'm not really... People read my posts all the time and I think I get real political, but I really like to be fact checked. I love it when someone comes at me. I like to have a real debate. So I was really interested to see what you were going to say about this one.
Yeah, and it's the only way you grow is by being challenged and having someone say, I don't really think that that's true, and here's why I don't. So, yeah, stretching's not bad. There's nothing wrong with it. And, kind of the thing with the mobility wrap around your arm that made your push-up magically just turn better, I can't explain why that works completely. I don't know. I have theories behind why it works, but it's almost all neurological, where I just change the sensation around that area and you move better. So what I was trying to do with that instance was train your body to say, okay, it's okay to do this. Because that mobility wrap wasn't wrapped so tight that it was holding anything in place.
Right.
It was just wrapped pretty loose. Gave you enough sensation change where your body said, okay, I can do this now. And then when I took it off, it kind of stuck.
Right. And it's not mental because I really thought it was just horse shit. I didn't think it was going to work.
Right, and you're the same way with Kinesio tape.
I am.
You think it's BS, so
it didn't work.
It's okay. Yeah, and it worked in some instances.
Yeah, it took the swelling away, but it doesn't seem to give me any stability or pain relief.
No, and the Kinesio tape's not going to give you stability anyway. Right. It's meant most of the time it's used in a what's called neurosensory application, which is just trying to reduce pain.
Right. Yeah, I didn't feel that. But it did make that swelling and that lump go down, which was really good.
That keloiding went away pretty quickly.
I like that.
So,
and he uses big words, so this is a really smart podcast.
Sometimes.
All right. You got a whole bunch of notes there. Is there anything else you want to get into on the back stuff before I start moving on?
No. How big of a soapbox do you want me to stand on?
I want to hear it. I brought you in here to talk about it.
So, again, I take this stuff really seriously because I think it's well-intentioned but irresponsible to say here's what you should be doing, because there's so many things that can cause low back pain. It could be a kidney, it could be a gallbladder, it could be a bladder problem, it could be anything. But if you say, well, just don't do stretching because that's the big mistake people make, yeah, people do make that mistake, but stretching is great for some people. And stability exercises, again, if you can't move your spine, you're not going to be stable. But one thing that's missing from here is there's the idea that about 80 to 90% of people with especially acute low back pain, which is usually short duration, they actually respond well to something called a directional preference, and that was never mentioned in this article. Now, you would think that if 80 to 90% of people respond well to it, that would be something you should mention.
Maybe he saves it for his DVD.
Maybe. But again, directional preference is not something that a trainer should be going over anyway. So the break it down really simple, the basic idea of a directional preference is we can move any joint or joint region in a certain direction, which will reduce that threat sensation coming back to your brain, and hence reduce pain or symptoms.
So you're talking like physical adjustment?
Not even, well, it's a self-adjustment. So it's not a chiropractor or PT manipulating you. It's you taking a joint as far as you can in one direction or another, and that's done with a diagnostic assessment. And directional preference is a incredibly powerful tool, but again, needs to be done under the guise of a medical professional. I would have had far less issue with the article if at some point in there he mentioned, if you have pain, the first thing you should be doing is seeing a medical professional. I would have had far less issue with the article, but it never mentions that. And again, I think it's dangerous to some degree. I mean, it's not like people are going to be going in there and dying all over the place, but it's just not good when you have a trainer saying, I can do that. I can take care of that. We can foam roll it out, or we can do these stability exercises to make it go away. You should find out what's causing it first.
That's when you get those serious back injuries, right? You do all this stuff and you kind of dress around the corners of the edge of the symptoms, and then when the problem really hits, that's when you're like, I can't move. I'll go see the doctor.
Right, because I mean, even any type of input to the body, whether it's stretching, muscle activation, which is a lot of the stability stuff, activating some of the deeper muscles of the spine, any of that stuff can mask your symptoms. Because you contract a muscle, it's a different sensation going to your brain. It can change your symptoms. It doesn't fix the problem. It's the equivalent of mopping a floor repeatedly when you have a leaking pipe. The pipe's the problem. The floor is alerting you to the problem. And the same with low back pain. Low back pain is a symptom alerting you to a problem. You have to find out what the problem is. And that problem could be coming from anywhere. It could be coming from bad footwear. It could be coming from knee issues or hip mobility issues. It could be coming from thoracic spine issues. Thoracic spine is where the ribs attach to the spine. It could be coming from a lot of different places. So just to say, hey, it hurts here, we're going to do stuff that works here, that's entry-level novice PT type stuff, which is garbage, honestly. It really is garbage. It's the type of stuff that you do when you're trying to see 4 patients at the same time, because it's like, okay, well, we do this, and there's a lot of reasons that these things pop up in the PT world and have stuck around for so long, and they're stuff that makes me really angry.
So before I get into some of the questions I have to ask you about what to do to relieve some of this pain, I'm going to advise you, before you do anything, you should go see a clinical physician or a PT or somebody to tell you what's going on.
Yeah, I mean, the people you should be seeing are either a chiropractor who's not a rack and crack, meaning they don't do the same 7-8 manipulations.
Dr. Rich Brown. I don't get any pay for this plug, but I believe in him, and I seen him, and he did a lot for me. Unfortunately, I don't go see him anymore, but I got Dr. Krol now, so I'm better off anyways.
A real neuro-ortho PT. So one thing that drives me crazy is when someone posts online that, my knee's hurting or whatever, so I reach out, which I only do maybe once every 6 months because it ends up being the same exact outcome. I reach out and they'll say, no, my aunt or my uncle or my cousin's a PT, and they looked at it, and I'm like, well, where do they work? Oh, Elderwood. So you went to a geriatric inpatient rehab facility PT. That'd be like me going to a podiatrist because my gallbladder's acting up.
My nose hurts.
Yeah, like I had a stroke, I'm going to go to a podiatrist. They know something about it. But so the chiropractor, a good PT, a physiatrist would be a physician type that you can go to, or an orthopedic.
Awesome. So I got some questions.
Oh boy.
Oftentimes on a roll, when I get stacked up or I have poor lifts, I get really tight in my back. And we've done some exercises for it. You've shown me some stretches, contracting my abs to release some of the stress on my back. Mm-hmm. What do you think are some of the best exercises, number 1, to do before you train so you don't strain your back, and number 2, when you feel that strain? Because obviously you go in, your back's not sore, then you do athletic movements and your back is sore.
One of the things I tell people all the time with a warm-up is that a warm-up should be sort of personalized to you. So we think of warm-up, we think of getting our heart rate up and our respiratory rate up, and that's really all we care about, right? Let's just get the muscles warm. I always tell people, in your warm-ups, go through your entire body and do checks, just moving your joints all over the place. And if you feel a restriction, clean it up. So if you're moving your head and your head doesn't move as well as it should that day, clean it up. Take 2 minutes, clean it up. Same thing with your lumbar spine. If the lumbar spine, you go through this warm-up and you're checking, okay, can I flex it? Can I extend it? Can I rotate it? Can I bend it sideways? If something feels restricted, clean it up. And that's kind of where I start first. It's not, okay, here's the exercise that you should be doing every time, because that may be a waste of time. It may not be good for you. But go through a check. If your body's not moving the way it should be, clean it up.
Good
I
catch.
lost my notes.
Good catch. He's got instead of all my regular guests bring notes on paper, Dr. Krol brought a little.
I got the tablet going
Yeah,
on
I got
here.
a tablet with a keyboard.
With the keyboard cover.
Yes.
This almost turns into a laptop.
You can tell you're a doctor because you got nice stuff.
Sometimes.
But he is drinking Mountain Dew.
Absolutely. Yeah, got to stay awake. It's well past my bedtime.
So I'm going to ask you another question about, I've been training with Mustafa, and Mustafa's really into dynamic stretching while you're warming up. So we'll do like lunges while you're warming up, and I've been actually doing this in my wrestling practices too that I coach for the adults. And I find that actually warms me up a lot better than static stretching. And, when you're doing it as a group, you're kind of forced to stretch anyways because it's part of the warm-up.
Right.
How do you feel? Is there a difference between like dynamic stretching and static stretching?
In general, when I look for athletic performance, I say static stretching is fine, but be further away from your actual athletic event. When you're close to your athletic event, dynamic stretching tends to be a little bit better for just athletic performance. Neither one is inherently better than the other. But if you go to a Sabres game, if you get there a half hour early, you'll see the players come out first and do a little shoot around. And you'll see some players taking deep stretching in the side, right? When they come out right before the game for their last shoot around, nobody's deep stretching. They're moving quick. They're doing a lot of different things, dynamic movements. So that's the way I look at it. When I work with you before your fights, deep stretch, mobilizations, an hour, 2.5 hours sometimes before you ever get in the cage.
Right.
And then you do your warm up and be more dynamic closer to your event. I would never have you deep stretch right before the event.
Right. I mean, my whole martial arts career, we did a quick warm up, then we static stretch, and then we trained. And I still do that in the kids class, but that's more honestly to show the kids the correct static stretches. To be
Right. honest
with you, I want to make sure they take something out of class. And usually, when you're that age, you don't really need to. I mean, everyone needs a stretch, but they're not like getting more flexible. They're already pretty darn flexible at that age.
Yeah, so and the bottom line is there is no best, and be willing to change when new information comes out. Athletic performance and the way we train for it and the way we prep for it, that changes as we get more science all the time. So just be willing to change with it.
Yeah, that's why I really enjoy working with you, because you're pretty liberal with your sharing of the knowledge, where you're stretching me and working on me.
Yeah, I mean, there's no points for keeping it to yourself. I mean, my goal is to make people better, and if someone takes something that I do and uses it for themselves, well, that's cool. They're reaching a person I probably wasn't ever going to reach anyway. So what do I care?
Yeah, all
Just
right.
make people better.
So back to what are the best stretches you think for getting your lower back warmed up, stretched out, flexible?
Well, again, it depends what the problem is. So we always have to go back to that. It depends what the problem is. So I don't really like the term best stretch, because if you have no problem reaching down, touching your toes, then don't worry about doing a stretch for that.
Right.
And that's a check. You reach down, touch your toes. Is it good? Cool. If it's not, think of all the things that could limit reaching down, touching for your toes. What's the first thing everybody thinks of when you can't touch your toes?
Your belly's in the way.
No, not your belly's in the way. You and I don't have that problem.
Stiff back, stiff lower back.
Oh, hamstrings, actually. People point to their hamstrings and they're stretching their hamstrings constantly. And that's usually a waste of time. But the things that can go wrong are anything in the backside of your leg. So it could be your calf, could be your plantar fascia on the bottom of your foot, could be the hamstring, could be the glutes, could be the lower back itself, the musculature. Could be the hip not moving well. Could be the lower back not being able to bend, the lumbar spine not bending the way it's supposed to. There's a lot of things that can go wrong. It could just be a matter of it doesn't work when they're standing. But you put them sitting with their legs straight out in front of them, and they reach down and touch their toes, it's fine. So something was wrong between them sitting down and standing up. So again, it's just a matter of finding out what it is. And again, that's where the assessment comes into play. I use a toe touch progression constantly with people, and that's where you reach down for your toes over and over again with your heels elevated and your toes elevated 10 different times each way. Nothing magical happens at 10, so if you do it 8, it's fine, or 12, it's fine. That's when I work with mostly the nervous system, because it's not making a muscle longer. It's just teaching the body that it's okay to bend that far. You don't have to turn these muscles in the back of your body on. So that's one I really use for getting the low back opened up and the back of the legs opened up. But again, if you don't need it, if you do that check, you reach down for your toes just fine, move on. Don't worry about it.
So let me add some caveats to it. So let's say you don't have any back pain. You're feeling your normal flexible self. You can do like Cobra stretch pretty well. You can bend and touch your toes pretty well. What should you do to just make sure your back's warm and ready to go?
Yeah, I like
at 100%.
I would just pick the motions and just go through them. So the toe touch, the Cobra, a supine twist where you're laying on your back, you send one leg across, just make sure that same side shoulder stays down. Now you're getting flexion, extension, and rotation, and you're just opening them up.
Right.
So they're not meant to treat anything. It's just make sure that these are opened up and working the way they're supposed to.
Right, because I'm just trying to, most of the people that listen are probably combat athletes, or, I'm just looking for them to have good stretches when they're feeling healthy, not like to repair some problems.
That's the thing. When you're feeling healthy, then you got to find the cocktail that kind of works for you.
Right.
Because some people just have low backs that just keep getting stiff on them. And they've gone to see a medical professional several times, and it hasn't fixed it. So it's one of those things where you have to live with it. So then you find a cocktail that works for you. Some people really like the supine twist. Some people need stability, like the guy in the article said.
Right. So let's talk about normal people.
Okay.
Work is probably the leading cause of lower back pain. What should people do? What's the optimal work position to be in for 8 hours a day?
I heard a line from a colleague of mine, Dr. Urson Religioso, so I'll give him a shout out with this one. I don't know where he got it from. He may have come up with it, but he was the first place I heard it, so he gets the props. He said the best position is the next position. So what that means is don't stay in one place too long. If you are standing in one spot, you're not going to feel great. Doesn't matter who you are. If you're sitting for too long, you're not going to feel great. I always use the example with people that if you were to get in the car and drive to Cleveland nonstop, nobody ever gets out of the car after about 3 hours and says, man, that's just what I needed. Nobody. Everybody's stiff. And then they start walking, they start changing position, and within a few steps, they're fine. So, yeah, the big thing at work is keep changing positions. Keep moving around. Don't let the body stay in the same place for too long.
Do you listen to Ben Greenfield at all?
I do not.
He had a great podcast with Joe Rogan. You might be interested in listening to this one. He talked about, I'm asking this for my fans, but I listened to a great thing he talked about. He's like, the best position you can ever be in at work is the one that you're not in now. So at his work, he's got a desk where he can stand. He's got a ball he can sit on. So he's doing multiple things all day long. And he's kind of a weirdo, so he's got like a sun lamp for his balls and stuff, like to create testosterone. And he does that at work. I'm like, man, I don't know where he works, but sounds like a cool place. He's got a treadmill underneath his desk. Like, he's got all kinds of stuff all hooked up.
Maybe it's Google. Google's pretty friendly with that stuff. But yeah, the idea is the same. Just keep changing your position. It's not that, okay, we have to get a better ergonomic chair. It's that we shouldn't be in our chair for very long.
Right.
Get up, move around, and yeah, if you can get a stand desk where you can lift it up and knock it back down, that's great, because if you stand too long, you get the same type of problems. You get stiff.
I can vouch for that. I don't sit all day long. I stand all day long. My back's stiff every day.
Yeah, so changing positions. And
I'm even doing your stretches every day. I try and do them every couple hours when I can.
Yeah, and it's one of those things where when I give things to patients and clients, I have to ask them, what are the type of things that you do throughout the day? Because there's some people that have these work demands and postural demands of life that they're not good for them.
Right.
But, it's not reasonable for me to say as a clinician, yeah, quit your job. That doesn't fly.
Some people say that.
Right, and some people are absurd. They're like, oh, you run 20 miles a week, well, maybe you shouldn't run. Well, this person's addicted to running. They're not going to stop. So you have to kind of work with them to try to, what can you do to get them through their activity better? And now, if you truly believe they shouldn't do it, then you need to be a responsible clinician and say, you shouldn't do this.
Right.
The risk of your serious injury is skyrocketing. And if they fire you, then they fire you. So what? You sleep well at night. But yeah, it's really, really important to keep changing position, keep moving around, and be honest with your people as to what you need to do, but be reasonable at the same time.
When you're having back issues, when's the time to go see a medical professional? At what point?
If it's persistent, there's really not much you can do to change it. You're taking ibuprofen. I think the guideline by physicians is 10 days. If you're taking ibuprofen for 10 days, you should stop and see a medical professional because there's side effects to ibuprofen. But yeah, if you're taking ibuprofen for the same thing for over a week, yeah, there's probably a problem. Or if you're trying to address it and it's not going away, Yeah, because everybody gets an ache and a pain. I mean, you don't need to go to your physician or PT every single time something hurts. I have had a patient or a client or two like that tell me, hey, this hurt 2 weeks ago. Does it hurt now? No. What do you want me to do about it? I mean, it was a random ache and a pain that happens, but something that's persistent, something that's changing your functionality, changing your way of life, then yeah, it's a good idea to see the professional. And it's better to see them early than later. Some people are like, oh, I'll wait till it's really bad. I mean, it's not really that bad, so, well, why wait until it gets really bad?
So 10 days, even if it's just minor but persistent, go see somebody?
Yeah, and because it's a lot easier to fix at that point. If you wait 7 months, now it's closer to a chronic condition, and it's much harder to fix.
So usually when I go to the doctor, I already know what's wrong. And I would probably, if I knew I had lower back pain, I'd probably want to see a sports expert.
Mm-hmm.
So what would you recommend? Like, just skip the doctor and maybe go see a PT?
Well, you can see a PT direct access. So what you're really looking for, the PTs that are direct access, that are the ones you want to see, are the cash-based ones. And I'm not propping up my brand. Those are just the ones that are going to spend the time with you. Those are the ones that are working with people that are also athletes, or taking their time and really getting to the bottom of it. They're going to work with you a lot better, and their subsequent sessions are going to be independent as well. So one of the things that happens with a high volume clinic is you see the PT one-on-one the first time, but they know darn well they can't treat you a certain way when you get in the general population. I make it sound like prison. But when they throw you in Gen Pop, you're being seen 4 patients to 1 PT. So they know they can't spend the time with you. So they have to tailor their program a certain way, an unethical way that doesn't do patients any good. So you really want to look for a cash-based PT, and I'll just give you some names of some people. There's myself, Dr. Krol, PT. Chris Nentars is another PT in the area, and Walter Brown's another PT. They're all cash-based.
I'll link Dr. Kroll's here because he works on me, and I can vouch for him. I don't know the other guys. I know Dr. Kroll talks about them and gives them props all the time, so I'm sure they're good. Mm-hmm. But I'll link Dr. Kroll's in here, and he's not paying me to do this. And to be honest with you, I should probably pay him more than I pay him. But
well,
it's good to have him in here, and he's coming in to do the podcast for free. And I have a lot of these questions because a lot of the guys are having some back pains and definitely some neck pains, which we haven't got into, but we will. And I want to talk about some bullshit stuff going on too.
At the very end?
Yeah, at the very end. We'll save that for the end.
We'll save it to the end so you can cut out if you're only here for the medical stuff.
Yeah. Go see a PT if your back's hurting. You can skip the doctor because the doctor's just going to send you to PT anyways. So unless you're
not always. Some of the physicians are really good. I don't want to throw them all into a bad boat, but you go ahead.
And what about seeing a chiropractor?
Chiropractor's fine too, as long as you find a good one.
Right.
So you have Dr. Brown, you said.
Yeah, Dr. Rich Brown.
You can vouch for him.
I can vouch for him. He's really good. He's really strong. He can do all the manipulations you need, and he's willing to work with you. He's not going to be like, oh, just come back. He's like, work on this stuff. This will help you get stronger. And that's what you're really looking for in a chiropractor. You don't want someone that just cracks you up because it's only going to last for like 10 minutes. You're going to leave, and it's going to come back, and you're going to feel it.
They open a window for you to move better and have less issue, less symptoms, but that window closes over time. If they're not giving you something to reinforce what they did, it's not going to remain better in many cases. Even if your symptoms go away, they are more likely to rebound than if you have some sort of activity. It'd be the equivalent of going to a dental hygienist, having them clean your teeth, and then you just not brushing, flossing, or using mouthwash or anything for the next 6 months. I mean, and just popping in breath mints so your breath isn't terrible. I mean, you have to maintain it on your own. And the same thing with our bodies. And why our bodies aren't treated the same way as our teeth is absurd to me. I mean, you're active every day. I'm active every day, and I take care of my body every day. And we do it with our teeth. Why don't we do it with our bodies?
People like to be fat and lazy. Not everyone brushes their teeth every day either.
Not everyone brushes their teeth either. And look what happens.
Yeah.
Look what happens. Their teeth turn into a mess.
And usually they don't work out so much either.
Yeah, usually poor self-care habits are interlinked.
So what about acupuncture?
It's just another tool in the trade.
Yeah. You want to go see an acupuncturist if you're not sure what the problem was?
I can't really speak to how well an acupuncturist's diagnostic ability is. I don't know enough about the profession they're training and to know what their diagnostic ability is. So to say they have good diagnostic ability or bad, I don't know. But it's a lot of people get benefit from acupuncture. It's a fine tool. New York State is actually one of 4 or 5 states that don't allow PTs to do something called dry needling, which is where we can actually needle a trigger point or a certain area, but they don't allow us to do it. So, but it's a really powerful tool. Every time I go to a conference or a seminar out of state, people are like, oh yeah, I'd throw a needle in there, and I'm sitting over in the corner all sad that I can't do it.
So it's not bullshit then?
No, it's way too much anecdotal evidence for it to be BS. And anecdotal evidence is still evidence. So people are like, oh, there's no research studies, there's no evidence. That's not true. You have millions of people that get better with acupuncture. So that's evidence to some degree.
Right.
It's just not a structured research study.
What about cupping to get blood flowing to the back? I heard about that too.
Yeah, cupping is, again, just any other type of quick treatment, like when I rub that metal tool on you.
Right.
I'll do that. A kinesio tape, hands-on treatment where I'll do a manipulation. Cupping, they're all in the same family, where I really think they're mostly changing the nervous system input to the area. So cupping does provide some level of bruising. So yes, you are changing blood flow to the area, but I don't know if it's having the effects that they say they are. One of the interesting things about medical treatments is, and this is where people get defensive, is that a medical treatment will work, but not for the reason you think it does. So you'll be doing something and you'll have a reason why it works. Yeah, it's working because you're getting blood flow to the area, or this is working because we're breaking up scar tissue. 5 years later, research studies will come out that show that that's not what's happening. And people are like, well, I made people better. It's not what the study says. The study is just saying that we're not increasing blood flow significantly, or we're not breaking up scar tissue. It didn't say your treatment doesn't work.
Right.
So, yeah, we have theories as to why these things work, but we don't really know. Almost every treatment I do, I don't know exactly why it works. And that makes me sound like a charlatan. But
makes you sound honest. I honestly respect that.
Yeah, it's just, here's my theory as to why it works. And there's a placebo effect to every treatment. Everyone. Doesn't matter what it is. Every treatment's got placebo.
I don't know. I don't think the tape does, because I don't believe in it.
That's part of it too. If patients don't believe something's going to work, their results go down, because placebo effect goes away to some degree.
All right, let's get into the neck.
Okay.
Now, this is a problem I have all the time, and a lot of people do. For me, when I jam my neck, my hands get tingly and go numb. And this is a very common problem among combat athletes, especially guys that get dumped on their head a lot. Sore neck, lack of range of motion. What should we be doing to address all this stuff? Besides for seeing a medical professional, which should be your first thing that you do all the time.
Yeah, so the big thing in the neck is honestly putting it in the right position. So both of us right now are not sitting with great neck position. My head's leaning forward into the microphone. So what happens when your head is forward, I'm going to get a little technical here, so you can throw something at me if I get overly technical. The lower part of your cervical spine, so maybe the lower 3 to 4 vertebra, are actually in what's called a flexion position. They're bending forward. But you need to keep your eyes on the horizon so your upper cervical spine will extend. So now you get this change in the curve of your neck that's unnatural, which will eventually put some pressure on the nerves heading in and out of the spine. And those nerves heading in and out of the spine go all the way down the arm. There goes the dog.
The dog interrupts every podcast.
We'll wait till Tripper is finished. Take your time.
He's old. He's had a hard time getting out the door.
So, yeah, everything that goes in and out of the arm. So all your motor skills, which are moving your muscles, all your sensory input, meaning everything coming from the hands, the arms, whether it's a sensation of hot, cold, touch, or whatever, all goes into your neck and upper thoracic spine. So if your neck is in a bad position and then you get dumped on it, or you get a axial load, which means a load through the top of the head, then it's going to compress those even more, which is going to lead to that tingling. So one of the best things I tell people to do is get your head into the right position. So again, this leads to that directional preference that I talked about. Most people respond really well to what's called cervical retraction, where they draw their head straight back, almost like someone's coming up to kiss you and you don't want them to. You draw your head straight back, and then what happens is that will change the curvatures of the spine and put them in the right place. So usually it's just a matter that our heads are not in the right position. And then that over time, that changes muscle tone around the neck and just makes us more susceptible to these problems.
So if you're feeling that tingling, should you take time off? Should you?
If it's a quick burst, then, you probably just got shocked, and, it is what it is. But, I mean, if you go to a medical professional and say, hey, I had tingling 3 weeks ago, and now I don't. I mean, they'll still try to put your head in the proper alignment, but they really can't test a directional preference as well as they should be able to. So if it's persistent or if it happens more easily, then yes, that's a symptom. Just like pain is a symptom, a change in sensation or tingling, numbness, burning, anything in your upper or lower extremity is a symptom that if it's persistent or getting more and more serious, then yeah, you should be going to see someone.
What about when your one arm is weaker than your other arm? That happens a lot too.
Well, if it's just inherently weaker, I mean, we expect about a 10% weakness from dominant side to non-dominant side. But if it's marked where you're gripping something and like you're at work, you're trying to hold something and it's not as strong in the one hand, well, again, all the motor information, Chipper's back again, all the motor information going out to the arm comes from the neck as well. So any problem that you ever have in the arm, you have to start at the neck. Your treatment has to start there. And if you don't, well, you're going to miss something, most likely.
Right. That's an injury that a lot of people I know have. Mm-hmm. It's definitely like G-Dot just hurt his arm the other day. He got slammed on his head and had to pull out of his fight just because his his arm were bothering him so much all the time.
Yep.
And he was the one that came up, asked me to see if I could work with him and corner him for the next fight. So he's better a couple weeks later, but
that's good.
Just need to take some time off.
Yeah, and that time off actually will decrease when you do go see someone that can take care of it for you and give you the right things to do.
Right. My pinkies were tingling for almost a whole year. My pinkies and my fingers when we first started working and you had me doing all those exercises, definitely helped out a lot.
Yeah, and what we found with your case was you didn't respond, or that didn't respond to the head movements. So I had to work further down. But for me just to say, oh, your pinky's problem, it's a problem with your ulnar nerve, which would, in layman's terms, is the funny bone. But you got to start in the neck.
Right.
And because if you don't, you're going to miss something. I had a patient one time when I was working at a clinic that he had bilateral carpal tunnel surgery, meaning he had it on both hands, and it was ineffective. So I was seeing him for neck pain was his primary symptom, and I laid him down and I pulled on his head, which in essence is trying to separate all the space between the vertebra and your neck. It doesn't really do it as well as we think, but that was the plan. I'm like, how are you feeling with this? He goes, well, my hands aren't tingling anymore. He was really unhappy. Not with me. He was fine with me, but he was upset that no physician caught this, that the problem was in his neck and not his carpal tunnel. And and that happens. There's unnecessary surgeries and unnecessary EMGs being done when basic rehabilitation and orthopedic knowledge is check the neck for anything down the arms, check the lumbar and sacral area for anything down the legs. It's basic.
Just to get off topic, and the conspiracy theorist in me is about to come out.
Uh-oh.
Do you think...
tinfoil hat?
Yeah, tinfoil hat time. Do you think a lot of that diagnosis just comes down to insurance? Like, this is the insurance mechanism for, oh, you got neck pain. Here's our insurance, what we have to do for the insurance. Here's what we can get paid for. You got this, so we're going to get paid for this.
I don't think so. That's overly malicious. I think people do get coerced by what insurance will reimburse. But one of the things I heard one time was if you give someone a hammer, everything becomes a nail. So if you go to see a neurosurgeon, well, the tool in their toolbox is neurosurgery. If you go to see someone who has an EMG machine at their clinic, well, they're going to do EMGs. So if you come in saying I have tingling in my hands, they're going to do neural conduction testing in your arm because that's what their tool is. I won't do it because I don't have that tool. So my tool is conservative care physical therapy. So that's what I go with. But it's a little different for me because I don't take insurance. But yeah, and that's one of the problems with the direct access, why so many physicians have fought direct access with PTs, is that patients will go to see a specialist physician and they'll say, oh, I'm going to go see, this person who deals with carpal tunnel. Well, what do you think that person's going to tell you? It's carpal tunnel. It's not because, hey, I got another customer in the door, I'm going to do another surgery. It's they found signs and symptoms consistent with carpal tunnel. and they're going to do the surgery. They're not trained, well, they're not specialists in looking at the neck and looking at the rest of the body. So their scope is at the wrist.
Man, we're fucked until we get the machine that you can go in and it tells you exactly what's wrong, like a car.
It doesn't work that way because there's people that have all sorts of pain. You put them in an MRI, there's nothing wrong with them.
No, like how the car diagnostic you plug
You
in.
just plug it in.
Yeah, we gotta get into the future. We could read every signal through the body and just plug into the machine and tell you what's wrong.
Both of us will be long dead before that happens.
Jesus Christ, it's scary. Like when you talk about it, it makes it even scarier than when we normally talk about it.
Yeah, why is that?
I don't know. It was in my head. I was like, so I'm gonna go see someone that already has a pre-diagnosed diagnosis of me, just basically on their area of expertise or what they're looking at.
Yeah, and that's a real problem, and this is one of my huge issues with PTs. That I saw a PT one time who will go unnamed, and I was watching this person. They had someone coming in for, I don't remember what it was. Let's just say it was a shoulder issue. The person starts taking their exercise card. They haven't seen this patient yet at all. They didn't know this person at all. And they started writing down exercises. And they started writing down the first progression, started writing down the second progression before they ever saw the patient. And I'm looking at it. And if I was a student, I would have thought, wow, how good is this PT? They know exactly what to do. But I'm looking at it as someone who gets pissed off by this stuff and saying, why are you even seeing this person? Why is this person coming in? If you know exactly what you're going to do before you even saw them, then that should be in an app and they shouldn't be coming here. I mean, that app should be developed and you're going to be out of a job. So it really pisses me off when people have their treatment already figured out before the patient even comes in. I do this with the UB students when I go in and teach a couple different seminars for the final
I remember when you brought me in. That was bad. I didn't mean to talk over you,
no,
but that was
okay.
funny.
So I'll ask the students, what are good treatments for plantar fasciitis is one of the ones I pull out because people come up with the same 4 or 5 exercises. They're like, ice bottle under the foot, a Strassman sock, which will pull the foot into dorsiflexion, which is basically pulling your toes back.
I know that because I teach that
That's
in
right.
class now.
I mean, it just sounds smart. 3-way calf stretch, great toe extension, and maybe even some posterior chain hamstring stretching. I'm like, okay, so is that a good program? Yes. I'm like, would you give that to people with plantar fasciitis? Yes. Like, okay, now be honest. When you're on your clinicals, because at that point I've already done 3 clinicals, did you ever do that to a patient and have it all set up before you even saw them? And I get like people looking down, people not wanting to answer, and I'm like, yeah, so what was the point of seeing the patient? Just give them a video of what to do, put it on a website, and put yourself out of business.
Yeah.
Do your job. Do your job.
I like that. I like when you
hard.
brought me in. You're like, so this guy's got all these problems. How old do you think he is?
Right, and if a person has all these problems, what do you do? And they're like, they're thinking to themselves, you can't do anything because this guy's had all these injuries. I'm like, no, you treat him like a human being.
Yeah. I like
and you
that.
see what the person can do. Don't assume they can do or can't do anything. I mean, I have people. I have a woman who's 92 years old, and she crawls on the floor. If you're like, oh my God, people who are 90 shouldn't be on the floor. No, you don't want them to fall and hit the floor. But if you never teach them how to get up and down off the floor and how to maneuver on it, then when I was a student, I was down at a nursing facility in Florida, and because I was a student, I had no capital. I lost this fight. I would put the inpatients on the floor. And an inpatient resident on a floor in a nursing facility, it's like people go berserk about it. People go crazy. Like, oh my God, this person's on the floor. Like, there's no better place to be on the floor than with your PT. But I lost.
Yeah.
I'm like, these people are going to be going back to their private residences on the peninsula. Let them learn how to get off the floor if they ever get there. But, yeah, it's a matter of just doing your job.
What do you think about spinal decompression? Getting back to the spine.
It's traction. It's a reasonable tool. Sometimes it helps people. Sometimes it doesn't. The one thing I don't really like about traction is there's nowhere to go from there. You can't really replicate it unless you buy a portable traction machine, which you can do. They're a couple $100. But I always look at spinal decompression and traction as sort of a last resort for people before you do anything invasive.
Right. Because Joe Rogan's going to talk about it a lot. He's got one that he hangs on a door frame and like pulls his neck up or something.
That's an old school one. You usually fill the
Yeah.
water bag with a certain amount and it'll translate to a certain weight. if you find that that's really effective for you, because if you're someone like Joe Rogan who is really active and probably getting pushed on his head quite a bit, spinal decompression may be a great tool for him. And if he can set up a way to do that at home, great, as long as it's safe doing it.
Yeah. Do you think it's good for fighters to try out? I always hear commercials for it, so.
Like, if you have the symptoms that it would fix, yes.
Yeah.
But if not, then there's, it's just another treatment. That's all it is.
So your neck's a pretty important part. When your neck is injured, what kind of symptoms should you go see a doctor for when you actually are feeling?
If you injure your neck and you're getting any change down the arm, you want to go see a physician. The longer, or a physician, chiropractor, PT, any medical professional that can treat it.
Even if it's like a quick stinger and it's gone in like 15 minutes or so?
Yeah, if it goes away, then it goes away, and now you just monitor it. But if you have prolonged symptoms like that, because that's usually leading or indicative of nerve compression. The longer a nerve is pressed on and compressed or irritated to the point where it's sending a false signal, the harder it is to take care of.
Is that when you get Miletich arm, where your one arm's all jacked and your other arm's like atrophied?
I don't know.
Like Boss Rutan?
Maybe. Maybe they just lifted one side.
Yeah, they both had like the neck problems and their arm like degenerated on the one side.
Yeah, you can get that. I've had people that have degenerated certain areas, like a tricep, where it's just not as hypertrophied as the other side, and that's, as long as it's functional, it doesn't matter.
Yeah, that's crazy. It looks retarded.
Yeah, the people don't like it, but it's what level of function do you have to get to?
Right.
If you're a bodybuilder and your level of function is I have to have symmetry, okay, that's a different story. But if you're just going through your day-to-day work life, then...
It's crazy because my weak side looks better than my strong side. Not very symmetrical at all.
No, you're not.
That's because this one's got fixed. The repair bicep has got like a perfect curve to it. I like it. I want to cut the other one off and get it so I look good.
Don't worry. The way you go, you'll probably injure it. So.
All right. So we got through the neck. We got through the back. Let's talk about some other stuff.
Okay.
Started CBD oil.
Okay.
And I'm not really sure I'm feeling too much from it, to be honest with you.
Yeah.
What do you think about CBD oil?
CBD oil, I lump it in the same category as every other supplement. They're not regulated by the FDA, and the FDA's got its own problems, but we're not going to get into that. So what that means is there's usually a certain inaccuracy with what's actually in the bottle. So there's a certain percentage of what you're taking that you don't know what it is. Now, I'm really not a big fan of taking something that I don't know what it is, so I wouldn't do it. I don't take supplements for that reason. And the other problem, too, is that when these supplements hit the market, they don't have to go through the same clinical trials that pharmaceuticals have to go through. Pharmaceuticals have to go through lengthy clinical trials, which is one of the reasons they're so expensive. People think it's just greed. It's not. It's a massive process to get these things out. But supplements don't have to go through that. So who do you think is the research study for this? The people who are taking it. So what they found out, I don't know if you remember the supplement ephedra.
Yeah. I like ephedra.
That was in the late 1990s and early 2000s. Well, it accounted for, I don't know how many percentage of the deaths, but it was somewhere around 90% of deaths related to supplements. Oops.
I took that. I took a lot of ephedra.
Yeah, people were like, oh, maybe we shouldn't take this. Well, how did we find out you shouldn't take it? Because
it was a great fat burner. It worked really, really good.
The human guinea pigs took it.
You may die taking it, but it makes you look good.
Yeah, you're going to look great in the coffin. Yeah. And I think that's one of the things I always get a little nervous with the supplements about, because the people can write anything they want on the bottle. And when I see stuff for CBD oil, I'm looking at things and, boy, this thing is great. It cures everything. And it's curing things in different types of super categories that aren't even related. It's like, oh, it's great for anxiety and depression. Okay, those are related. It's great for plantar fasciitis. Oh, wait, hold on a second here. What? Cures cancer. It does this. And they can say anything they want. Those statements aren't backed by the FDA. They're not backed by research. So how harmful is it? I don't know if it's going to be harmful at all. It's probably fine. But we don't know. And the people who are taking it are going to find out for us.
Anecdotally, I've been on it for about 2.5 weeks now. I told you about it last time I was over at your house. I started the day before then. I didn't really feel too much. Mm-hmm. I was off all pretty much last week with the snow. And I trained this week, and I haven't had that pain in my arm at all since I started taking it, but I haven't been training either.
Mm-hmm.
So it's hard to tell if it's affected that at all.
Yeah, how many variables are there?
Right.
You know, you can't.
The knee pain that I started to take it for, which I've been feeling the whole time, I haven't felt any difference in.
Mm-hmm.
The only benefit I would say I have is I feel like I've been sleeping better. I don't actually get enough sleep ever.
Right.
And I've actually dreamed almost every night that I've been taking a CBD oil, and I feel a little bit more rested when I wake up. So I don't know if that's an actual effect of it, or
we don't know.
Yeah,
because again, there's no research studies to really show exactly what it does and what its effect on the body is. And you know, I know there's some side effect issues with Coumadin in the body thinning the blood, but I'm not. I would be lying if I said I'm well versed on what all these side effects are. But again, I don't think it's the CBD oil that's the problem. It's the 2 to 5% of mystery meat that you're getting in the like I told you earlier, it's like a hot dog.
Right.
You don't know what this is. So I mean, they find all sorts of stuff in supplements. It's not good for you. Mercury and arsenic and this and that in trace doses, but if you take it enough, it adds up.
Right.
So I get real leery of the supplement game just because of that.
Not big for supplements. What about creatine? Creatine's been proven, right, over time.
Well, again, it's not regulated.
Works. You might get some steroids in it too.
There you
like
go.
John Jones.
There you go. John Jones.
Cutting up your steroids or your coke with it, and you get some failure drug tests. Not so good.
No, not at all. Yeah, I mean, supplements, they're not regulated, so my stance on supplements is always the same. Doesn't matter which one it is. Just supplements get hot, and people are like, oh my God, we got to take this, and everybody starts taking it, and then we maybe find out it's not what we thought it was, or this has some side effects that we don't really like, but you don't really find out until you take it for a year. And then, a lot of people taking CBD oil have fill in the blank as to whatever condition. Oh, there's
right.
cirrhotic liver or kidney failure or whatever. And it's like, oh, maybe we shouldn't take this.
Yeah. Or the way they process it. You never know, because there's different ways to ingest it too.
Yeah, and that makes it really hard for the epidemiologist to figure out, what the problem is, because there's no regulation as to how it's produced. So people are taking all sorts of different types of CBD oil. I mean, CBD oil companies are popping up all over the place.
It's huge.
And yeah, it's big. It's hot right now. And yeah, I just get leery of it, and I'm kind of I'm like the not cool guy. I'm like, hey, maybe we shouldn't do this. I'm the kind of the bum, the not so fun person, but
you just give me the stuff, I'll try it.
Yeah,
I'll let you know how it goes.
I just tell
we'll do our own
people,
studies.
and you've talked to me about stuff like this before, and I tell you the same thing. You can try it at your own risk, and we don't know what it does. So, if you want to be a guinea pig for it, great. If you feel it can help you, fine. But just be aware that we don't know what it does. So,
I haven't had awesome inflammation results yet. That's what I was looking for. I don't know.
But you don't have plantar fasciitis. So
I don't have plantar fasciitis.
That.
Maybe it does.
I mean, we don't know. So.
I've been sleeping good too. I'm just saying. I don't know.
So could it be helpful? Sure.
I'm trying it coming from a place of disbelief as well. I'm not really big into anything, to be honest with you.
The thing I really have the problem with the supplements, I don't have an inherent problem with an alternative medicine or a holistic approach. What I have a problem with is going to the holistic approach at the complete discredit of the biomedical model, which has saved millions of lives over history. So when people say, oh, I just don't trust physicians. So what you're saying is, I don't trust physicians that know exactly what's in the pill they're going to give you. I'm going to take this from these non-medical professionals who can't even tell you exactly what's in the product or give you any research as to what it does.
Well, they'll tell you what's in the product, but they can't prove it.
They can't tell you 100% these are the ingredients. They can't tell you because they don't know. The physician can say, well, we're going to take this medication here. Here's your side effects. Here's a full list of what we found to this point as to what your side effects are. Here's what it should do. Here's the biochemical means that it does it. It's going to block this receptor, or it's going to change this neurotransmitter, or it's going to do this or that. So at least you know how it works, what it's supposed to do. But people discredit that because they're like, oh, the pharmaceutical companies have the physicians in their pocket. Some of them they do, sure. But I trust that a lot more than I trust this. And I always look at the adjective alternative as exactly what it is. It's an alternative care. If this stuff doesn't work for you, then sure, go to some of the supplement stuff. But, I have people that come in and they're like, yeah, my knee's been bothering me for about 8 or 9 weeks. Oh, what have you done? Well, I rubbed rose hips and bee pollen on it, and I tried arnica, and I did this, and I did that, and boy, nothing worked. And I did this, like breathing exercise, spiritual stuff, and I tried to send my breath there. It's like, are you kidding me? You went 8 weeks and did that before you finally saw someone? And I had someone that did something like that, and then a week and a half later, they had no knee pain. It's not like I'm some sort of genius guru here. I just did what I was supposed to do. And any of the other PTs that I mentioned earlier could have done the exact same thing and got the exact same result. And I'm like, just go to the right person first.
So I have a question for you. I'm not sure you can answer. It's a little bit out of your realm of expertise. Why aren't there studies on these supplements? I mean, you can find studies, but they're done by the company that actually sells a supplement. Why is there not something that's independently testing these supplements? You think it would be a big business?
Many reasons. Just with treatments, the treatment comes before the research. So the treatment is born out of theory. And, the universities are not going to pick up, grant money for this study on something that nobody's ever heard of. So people start using kinesio tape based on a theory, and then the researchers come along and say, well, we want to check this independently. I mean, like Rock Tape will come out with their own research. Well, they're selling the product.
Right.
It's a bias right there.
Yeah, the only actual human research I could find on CBD oil was done by CBD companies.
Right. So now that it's getting hot, you're going to start to see grants come in, or you're going to start seeing physicians that are suspecting that I'm seeing more of this type of response in my patients, and many of them are taking CBD oil, and then they start doing research studies on it. So, a supplement will get out into the market like a Fedor, and then the research will come after it. A treatment like kinesio tape or cupping will come out and get hot, then the research will come after it and say, well, this theory is correct or not.
Think there's any place on the market for like an independent company to do something like that? Sell the results?
Well, they do, but it's the research game is just as corrupt and dirty as any other game, because there's money involved and there's people involved. So, yeah, research comes out all the time, and I don't know how these things get through and get into research studies. I look at some of the research and, things that I know really well. Research comes out, and I just think to myself, how in the world did that research get out? Because you applied this tool completely incorrect, and then you're doing research on it. Like, it doesn't make any sense, but it does. So
it's just like the whole world now. Like everyone's political knowledge comes from Facebook. Just like today, I saw a thing about Cortez, and it said you put this lady in charge of the finance department, and she has terrible credit, and she's been evicted twice from her apartment. And really, someone just wrote that on Twitter, and it just built up, and that's where it came from. I fact-checked it today to find out, because I was like, are you kidding me? So then I looked it up because it made me irritated. So I was like, oh, this can't be true. So I checked it out, and it wasn't true, obviously. And
one of the things I tell my patients is you have to be the biggest advocate for your care. Now, you could go into a rabbit hole and spend weeks studying all this stuff, but you have to research your conditions. You have to research the pharmaceuticals you're being given. You have to research the treatments that you're being given. You put your trust in the medical professionals that are giving them to you, but if you don't do your own research, I mean, you may find that this isn't the right thing for you. So, or you may find, hey, maybe I can have a discussion with my physician or my PT or my chiropractor about a CBD oil or anything else, a topical like a arnica or something, and say, hey, maybe we can have a discussion about this and exchange information. But yeah, you have to fact check your own stuff, and you're the biggest advocate for your own care all the time.
So if your doctor is not willing to have a conversation with you, you should probably go see another doctor or try a different place, get a second opinion maybe?
Yeah, second opinions are great. Honestly, no medical practitioner should be scared of a second opinion. They shouldn't be, because if they came to what they feel is the right diagnosis with the tools that they have and the expertise that they have, then they're going to stand behind it. Now, if someone who's a more skilled practitioner or a more experienced practitioner or has better tools in a certain area comes up with a different diagnosis, that's fine too. Again,
Right.
your end goal should be to help get your patient better. Now, a lot of people look at this the wrong way, and they go get second opinions when they don't get the answer they want, and you just let those patients go because they're not going to listen to you anyway.
Right.
Like you told them to do something they didn't want to do, and they don't want to do it, so like, oh, okay.
I get nervous when the first answer is to go get a surgery. I always tell when someone says their doctor told me to get surgery, I always say go have someone else look at it real quick, just make sure, because it's a pretty big step.
Yeah, an invasive procedure, a surgical procedure, the problem with it is you can't go back from it. Once you have it, now you have surgical complications, and I mean, low back surgeries, they fail 50 to 60% of the time. And when I mean fail, I don't mean that the surgery didn't take. I mean that the symptoms didn't change or they didn't go away to the patient's expectation. That's a failed surgery. So now you have to live with scar tissue and maybe a fusion in the spine that you can't undo, and now you've handcuffed your PT and your chiropractor. So I always tell people, exhaust your conservative care options and then go through your invasive options from the least to the most invasive. If you're just gonna jump the gun and have surgery, there better be a really compelling reason to do so. The physician better make a really strong argument for that to happen, especially musculoskeletal.
I'd also say if you're about to have a surgery, research people who have had that surgery and continue to do the sport that you like to do, whether it's jiu-jitsu, running, surfing, skiing, whatever, because there's a lot of people out that can and can't continue on after they have surgeries.
Right.
Me and Mustafa were just having this talk the other day about getting his knees done, about getting artificial knees. He's scared he's not going to be able to wrestle anymore if he does it because he can't find anybody that had artificial knees replaced being able to still wrestle and do jiu-jitsu effectively. I mean, they can still do it, just not
Yeah, a lot of people
at
when
an
they
effective
have
level.
when they have those type of surgeries, they lose that end range flexion of the knee, which you need if you're going to deep sit in jiu-jitsu or wrestling. I mean, you're sitting onto your heels quite often, or you're having to bend your knee to terminal knee flexion to pass through something or to step over, and that when you lose that changes your game. You know
what's really scary for me is he's talking about getting a knee surgery because he can't move his knees and he's more flexible than me.
Yeah, you were not the picture of mobility, but you do well enough for what you're trying to do, and we've gotten you a lot better.
Everyone says like you work magic because they're like, dude, time doesn't even affect you. You're 42, you're in better shape than everybody. How's that happen? So how do you make me better than everyone at 42?
Well, I can't take credit for it because I heard one time that if you take the credit for something, you also have to take the blame when it goes wrong.
Oh boy.
So you want to be careful of taking all the credit. No, you have some genetic gifts. I mean, you have a cardiovascular system that is better than most I've ever seen. So I mean, you just don't get tired. You don't get fatigued. You just don't shut down. So you have some of those genetic gifts. You're determined, so you're going to push through something when other people would quit, and that's that has nothing to do with your musculoskeletal system. It's how you use it. One of the things I think for you is important is that you have embraced the idea that you need to keep moving or you will stop moving, and that happens with people when they retire. They stop being active and then they die 3 years later. You're in a position where I may argue that maybe you're doing too much of this or too much of that. You're dosing it too high. But the bottom line is if you dose it down to 0, you'll be a wreck within a year. You'll be an absolute wreck within a year if you just stop being active. So keep doing your jiu-jitsu, keep doing your thing, and just keep moving or else you will stop.
I just want to say, like, everything you had me do, like the range of motion, flexibility has made me a stronger, better athlete. I feel maybe not a better athlete than I was 6 years ago, but I feel like a more flexible than I've ever been in most of my life. Mm-hmm. Discounting my injuries, obviously. Right. But I feel great. Like, when we work out, I feel good. I feel like I can hang out and be competitive in jiu-jitsu for another 10, 15 years. And I still want to beat up Tyler Collins one more time. So.
Yeah, I mean, I can't make you... I can't give you the genetic gifts that, some elite athletes have that are just born with it. Like Pat Mix has genetic gifts that nobody can give you. Right. So, we're never going to give you that, but can we make you the best version of you that we can do? And that's the point. And honestly, I always look at mobility first, because if you can't move through a range, then your muscle can't contract through a range, or it's going to stop contracting when it gets near that end range, or it's not going to give you the force that it should. So you need to be able to move first. And I butt heads with people on this all the time. People are like, oh, no, you shouldn't mobilize a spine that's in pain because you can blow out a disc and this and that. It's like, oh, brother. I mean, you have to move things. You have to have the best range of motion you can possibly get. It doesn't have to be full, according to what the AMA says, but if I can improve dorsiflexion 5 degrees, that's going to help you. If I can improve your spinal mobility 5%, that's going to help you. And that's why I focus so hard on that.
I just want to say, if you're over, I would say 32, 33, you should be seeing someone to help you with your flexibility, make sure your range of motion is good if you want to be a high-level competitive athlete. And I see that, I think personally, right about 30 to 32 is the age where the injuries really take their toll, and we're not really doing enough to be flexible. And the last 10 or 15 years, I've been really watching it more and more and more, and I think that's about the age for our combat sport that the body starts going. I mean, sometimes we lose our chin before then,
right?
And that's something you can't fix. That's just too much head trauma. But, man, I think 30, 32 is the age where we start really physically breaking down. We really need to start getting more mobility training in and really start working on ourselves.
Well, this is one of the instances where the analogy of the human body to the car works. There are some instances where it fails miserably, but in this instance it works. It's more important to do your maintenance on your vehicle as it gets older. You got your oil changes, you got to be tight on them. You can't miss them. You have to put the right fuel into it. You have to just take care of all the components under the hood, or else it will break down. It will leave you stranded. So the human body is the same way. As it gets older, it needs more care. It just needs more maintenance. And I always say that you get one body, it's the most valuable possession you'll ever have, and you can't replace it. So really take good care of it, or else you will pay the penalty for it. In every way, shape, or form. It just sucks when your body doesn't do what you need it to do.
I like that. And I'd really, man, trust me, go see a PT, go get it done. Do it before you start having problems.
Yep.
It'll really help you out.
I always compare PT to dentistry, whereas you see your hygienist before your teeth start to hurt. You don't see them because your teeth hurt. You see them so they don't hurt, and you see them so that your mouth is in the shape it should be in. So why don't we see our PT or someone who can look at us musculoskeletally at least every year?
Yeah, I definitely think you need a strength and conditioning coach and a PT, and hopefully you can get them all in one, but if you can't, you should definitely see both.
Mm-hmm. Yeah, it's a lot cheaper to see a PT once a year or maybe twice a year, have them look you over, even if it's a cash-based one. People say, oh my God, it's so expensive. It's a lot more expensive to be laid up.
Yeah.
I mean, for whatever it's going to cost to see a cash-based PT twice a year, let's say $200 to see them twice a year, would you pay $200 to be in an optimal condition? Well, yeah, that's a steal.
Well, dude, if you're a fighter or you're a jiu-jitsu guy, your body is your tool. You got to keep that healthy. That's the most important thing you can do. Eat right, take care of your body. Skill set's almost third, to be honest with you.
Yeah,
if you're going to do it for longevity.
Yeah, if you don't have the platform to put a skill on top of, it's going to fail eventually. Unfortunately, it usually takes it failing before people learn that lesson.
Yeah, trust me. I've learned the hard way. Trust me. Listen to me. Do it. Get it in. Yep. Dr. Krol's had to fix me after many surgeries, all because I don't listen. And probably this arm soon, too. The way he's going, you're right.
Maybe.
Hopefully.
You're gonna do it on purpose, so it just looks the same.
Yeah, I wanted to get that nice curve, man.
Right.
This one's all flat. It looks terrible. It's really strong, but it's terrible.
You're gonna enter a bodybuilding competition like 105 pounds. You're just gonna cut down.
I might. You never know. I do some crazy stuff.
Yes, you do.
What do you think about Fedor? We're old school MMA guys. If you don't know that about Dr. Krol, me and Dr. Krol started out watching MMA together from UFC 2. So
yeah, UFC 1 and 2. Or we watched UFC 2 and then went back and watched 1.
Yep.
So yeah, it's most athletes stay around a season or a fight too long. And I think when you look at the cases like Fedor or when the UFC has a mismatch in terms of age, I mean, you can correct me if I'm wrong, but don't jiu-jitsu tournaments have a Masters division?
They do. And they have Masters 2 even. So
right.
Masters 2.
I don't see any reason. And I think it would be lucrative because a lot of people, I mean, some of these older fighters are still a draw by name, just have a Masters division and have a Masters belt over 40.
I've been pushing for that forever.
I mean,
oh my God,
Fedor
should
so never have been in there with Matt Mitrione. He should never have been in there with Bader. And it's not that Fedor couldn't knock them out if he hit them. But as the Matt Mitrione fight showed, they hit each other, and Matt Mitrione got up. If that was 10 years younger Fedor, one, Mitrione wouldn't have gotten up, and two, Fedor wouldn't have went down.
Right.
So it's not that Matt Mitrione's a better fighter. He was that
better
day
athlete.
because he's a better athlete and a younger athlete. So, yeah, I would really push for a Masters division. Fedor's time is just come, and that's all. He was great in his time, and his time is over.
We had Mr. Moore on a couple times on this podcast, me and Ray. Actually, he's one of Ray's friends. Mm-hmm. And he's trying to put together Legends of the Cage and have like just the legends fight each other instead of being like fed to the wolves and fighting, younger guys. And then he's kind of like a flying liberal, so he's trying to give all the money to the fighters. So I don't think that'll ever come to fruition.
Probably not.
But I think that's a great idea. I think it'd really sell too. I mean, I'm not sure you could do it on pay-per-view, but you could put it on the undercard of every one of the UFC cards or the Bellator cards. It's huge.
I mean, Tito Ortiz, Chuck Liddell, Ken Shamrock, I mean, they still draw feelings out of people. People are still going to go watch them, especially some of those casual fans who kind of dropped off from the UFC. They remember those names, and they're like, oh, I remember that guy. You would get someone to watch it, but if you go out there and watch a slaughter, that's
Tank Abbott against Frank Shamrock.
There you go.
Fight we need to see.
Absolutely. But
Even today.
But I mean, you could have I know this is 10 years past when we wanted to see it, but you could have a Fedor Couture fight now.
Yeah.
I mean, I think Couture would win, but
I don't know. He looked old. I just seen him do a video. He was training with some Hollywood star. He looked old.
Well, maybe not then.
He looked like time really hit him. Like they were doing a pummeling drill, and he's clearly much better than that guy, but he didn't look like Randy Couture.
Yeah. Nobody beats the clock.
Might be the Hollywood life too, though. It's hard to tell.
But I mean, Fedor fought Frank Mir, and that was a competitive fight for them. Mm-hmm. And honestly, Mir, 10 years younger, would have put Fedor out with that punch. That's just how it goes. But they're in the same age group, so you're kind of leveling the playing field.
I think Ryan Bader might have beat him back in the day, too. Maybe. He looks phenomenal at heavyweight. Phenomenal. It's so hard to tell when he's shooting and throwing that crazy hook he throws. It's like that modified lead hook overhand. It's hard to read because he gives you that fake and to react. It looked like Fedor didn't want to get taken down.
Well, he didn't want to get taken down. He didn't want to get hit either, probably.
And probably not hit, but he didn't seem as scared about the hands as he did about that takedown. And, man, he really made a bad choice there. Yeah. Or he just didn't react fast enough.
He didn't react fast enough, and the hands stay down, the head stays high anyway.
That's how he fights,
That's how he fights, though, and that's not going to change. And, when you're fighting someone that's a lot younger and faster, I mean, Bader's, 35?
I think so. 32 to 36, somewhere in there.
So that's a significant difference from 42. And, yeah, you're going to get hit, and you're going to go down. That's just how it goes.
The best he's ever been. He looks just phenomenal. Yeah, that's two. He knocked out Mo too.
Blasted Mo.
Same thing. Mm-hmm. Same punch even.
Yep.
So it's tough he's such a good wrestler, dude. You can't not buy that fake. It's tough. It's a really good attribute to have. As long as I got you here, you made me think about it when you talked about it. Chuck Liddell, when we talked about the fight, you said it looked like he had a lower back injury, almost the way he was moving.
When I saw him moving around at the public viewing weigh-ins, he looked like someone had fused his lower spine together. That was the most unathletic. Now, I've never looked at Chuck Liddell as a great athlete, but he never had an overly athletic movement to him. But wow, he looked terrible. I mean, he just even walking around on that stage with Ortiz, I'm like, this is not going to go well. I mean, his lower spine was just locked down.
Did you see the videos of him hitting pads before the fight? I don't know if they released them now. I'm not sure they did before the fight, but he looked terrible. He was throwing punches. He wasn't even turning his back with the punches.
Yeah, there's a complete disconnect between your upper and lower body, and I've told you many times, when you do that, you lose a ton of power and a ton of speed.
Do you think that maybe he's not washed up? Maybe he just had a really bad injury? Or do you think he's just
don't know.
Washed up?
He might just be washed up. I mean, he might be washed up because he can't get through whatever this condition is.
Right.
But he just looked as unathletic as I've seen any high level fighter look. I mean,
he looked bad.
He looked awful.
Tito looked good on
And I remember I told you that at the weigh-in.
Yeah,
I'm like,
the day before we talked about it on the phone. We should have bet that fight.
I'm like, yeah, this isn't just by athletic appearance alone. This is not good. And yeah, Tito looked great. Mm-hmm. I mean, for his age, he looked great. And again, when you're in the Masters division like that and fighting people at your level, it's good.
I think they'll be entertaining fights too. To be honest with you, really, really do.
Yeah, I mean, hell, I mean, Fedor fought Sonnen, and
yeah,
we all talk about that flip attempt, and it was an entertaining fight.
That was good.
Yeah, it's fine as long as you understand that. Hey, this person can't get in the ring and beat, John Jones. Okay,
just think, Chael Sonnen's like a legit fighter too, just not a legit heavyweight.
Yeah, no, that was. Yeah, they're a little light on the heavyweights in Bellator, so they were just firing people in there.
Yeah,
so
he's got a big mouth. He can sell fights. Dude, his podcasts are really good.
Yeah,
you should listen to him.
Yeah, I made the comment one time, and I'll go off on this little tangent, but I made the comment to another friend of mine that pro wrestling that I'm a fan of.
Oh boy, here we go.
Is labeled as sports entertainment, and I think that's incorrect. I think it should be labeled as entertainment because the way I look at it, there's 3 levels. There's sports entertainment, and entertainment. So sports is where your outcomes are not predetermined, but you don't care about your audience. You don't like. So we did jiu-jitsu today, and the people I was rolling with, it's a sport, but I didn't care about selling a ticket. I didn't care about being exciting. I didn't care about anything. So it was purely sport. Now, sports entertainment is when the outcomes are not predetermined, but you care about your audience. You care about moving units. That's the NFL. That's the UFC. That's the NHL. And entertainment is when it's not it's the predetermined outcomes and you care about it. So yeah, you want entertaining fights. You are you're a sports entertainment company. So you should be promoting that into your fights. Like if you can get Ortiz and Liddell and it's entertaining, cool. And
it doesn't bankrupt your company. Poor Golden Boar.
It's sports entertainment, and people I think get that mixed up. They think pro wrestling is sports entertainment. It's entertainment. It's not different than a movie. I mean, the outcomes are predetermined in a movie.
Right.
It's like pro wrestling is no different than watching Rocky.
It's a movie with lots of stunts.
Right.
It's a movie that's an entire stunt.
Yeah, it's fixed outcomes. I mean, the injuries they get are real, but it's entertainment.
It's like the circus. It's a show.
Yeah, and they get hurt all the time, and they use performance enhancers, and I don't have a problem with it because there's no sport aspect to it.
What do you think about the sport when they use performance enhancing drugs?
Well, again, now it just becomes a line of what do you deem illegal, because everything is performance enhancing.
Right.
Down to the equipment that you use, over-the-counter medications. So it's a cat and mouse game where the people who are trying to push the envelope get ahead, and then the people testing catch up to it.
I like the old Pride days.
Just
take whatever you want, have it out.
If everybody's on the same page, then it seems fine. I guess my issue with it is not so much with the fights or with the fighters, but you look at more organized league sports like football, where that type of behavior then trickles down into the high schools.
Right.
Where now you're getting people who, I mean, you don't make great decisions at 16, 17 years old. But honestly, if roiding up for a year is going to get you the scholarship, even if you're never going to go to the NFL, now your college is paid for, you're going to do it. And if it's allowed in the NFL, then that's a trickle-down effect. You got to stop it somewhere.
Right.
So there's no easy answer to it.
That was one of the best answers I've ever had in this podcast. I had a lot of guys really in the field. Even educated guys in the field. That might be the best answer I ever had for that.
Very good.
I like it.
Yeah, it's going to trickle down. And where do you stop it? Well, I mean, you're never going to win the fight, but you got to have it anyway. I never liked the analogy of saying, well, you can't stop it anyway, so we should just legalize it. I mean, because you could apply that to murder.
Right.
So it's like, well, you're not going to stop it, so just make it legal. So.
My wife would like that.
There you go.
It's very much against weed. Actually, I did read this from, I heard on the Ben Greenfield podcast. For all the fighters out there that are listening, I heard that continued marijuana use lowers your testosterone. So be aware of that.
Yeah, Yeah, and then you got to take a TRT and get that all approved and go through that whole process, and you still get dinged for it.
But it's only in effect while it actually goes away when metabolite gets out of your body or something. Something about the way your body processes weed suppresses testosterone.
But as much as I know about the endocrine system, the glands that produce any type of hormone, if they're not needed, they atrophy and they don't come back. So.
Oh man, you guys! I'm not gonna name any names, but some of you might be in a little trouble.
So again, this is a little out of my expertise. I know some about it, but yeah, one of the reasons when people start taking testosterone inappropriately, well, then they get stuck taking the rest of their lives because the glands have atrophied because the body says, cool, I don't need to do this anymore. It shuts them down, and then all of a sudden you stop taking testosterone, your glands are like, I'm not coming back. Screw you.
What about testosterone replacement? Does that happen with that when they're monitoring your levels, so you keep your levels at a normal level?
Yeah, I mean it still happens. So you're kind of, once you get on the road, it's as far as I know, unless something has changed in the physiology of it that I'm unaware of, that's kind of how it works. Oh. Yeah, once you start using it,
so you're on TRT for life once you start. Poor Vitor.
If the glands have atrophied that much, yeah. So.
I was thinking about seeing if I could get on TRT too.
Well,
jeez. So I probably shouldn't do that, huh?
That's not a discussion for me to have with you because that is not my realm of expertise.
I want to stay young forever, man. I don't want to get old. I want to keep training.
Hey, you can't beat the clock.
I just want to cheat the clock till I die.
There you go. Die young, and then you cheat it for a longer percentage of time.
Yeah, exactly. If I go at 50 and I'm training till then, I'll be all right.
There you go.
Forced to be growed up, kind of. That's all that really matters. Any plugs for your business?
Yeah, I mean, you can come to find me at Krol Physical Therapy and Training on Facebook, or KrolPhysicalTherapy.com is my website. You can find all my services there. Jeff talks about me, I don't know how frequently on the podcast.
Almost every podcast.
Every now and again he mentions me. So, yeah, I'm a cash-based PT, but also into fitness training as well. My big thing is to transition people from medical to fitness, and to deal with people before they ever become patients. So I'm really a big fan of seeing people. I see people as infrequently as once a month, and just get them on a path, and let's try to make them not become patients for any long period of time. So most of what I do is preventative. If I could run a business where I never had to see a patient again, that'd be great.
Not for your business.
No, it'd be great because I'd be dealing with people who are not patients and never going to become patients because I'm working with them preventatively.
I got you. The dog wants some love now, too.
The dog is needy.
I took Dr. Krol to open mat today. We've been training together. 2-stripe white belt under Caveman. How'd you do today?
Got housed.
You didn't get housed. Come on, I'm trying to promote my teaching.
I have kept up the streak of being the worst performer in every room I walk into.
That's not true.
But no, to be perfectly honest, I don't train with a lot of frequency. I train with you, and then I work on some stuff privately, but I don't roll regularly. So if maybe I would say probably our frequency is once every 2 weeks, I would say, or maybe 1.5 weeks if you're going to average it out, that we see each other for private lesson. And yeah, my goal is to, and I was telling, I think it was Donnie, this. I said, my goal is to, if I run into a normal person on the street who's a bit bigger than me, a bit stronger than me, that I can handle them. That's what I've always wanted to do. It's always been my goal in martial arts. So I think I can do that, but, I always want to get better.
I thought you did pretty good at it today. You ended up on top a lot, did good sweeps. I didn't see the submission, the lapel choke when I was rolling Herbert, but I thought you did really good, man. Your attacks look like they need a little work. Yes. But getting them out, you did a great job getting them out, and that's basically what we've been working on.
Yeah, I think the idea that you're kind of going with is let's get into position. I've heard before was it position before submission?
Yeah.
So you kind of have to get there before you can attack. So, yeah, I mean,
I believe in having change. Right now, my philosophy of teaching is I want to be able to get to a position and have some change off of there, and that's what I was trying to get you to work on Donnie. From going to like the Americana to when he pushes up, going to the armbar, and then I have next time we go, I have an armbar series that I want to show you, like what to do when they sit up on you. What happened to you? Exactly what happened to you today when you go for the armbar and you sit away too far, because that's a mistake you're making. You're giving him too much space for him to sit up.
Right.
You're using the leg correctly, but you had too much space between your hips and your arm, so he's able to turn into you and get his elbow to the mat. But I have some answers for that too.
Okay.
So we'll look at that when I see you next.
Growing and keep working, but yeah, it's a slow process for me, but I don't really care about belts, and I'm not addicted to it like a person who has to roll 6 days a week, but I enjoy doing it.
I like it because now you're seeing like the attributes that I need to compete and what I get dinged up doing, and
right.
I think it's gonna help me.
Well, yeah, that's the point. You gotta learn what your people do, or else it's really hard to train them or hard to work with them.
If you are doing jiu-jitsu, he's definitely the guy to see because he's gonna understand that you need to train no matter what's hurting you, and he's gonna tell you not to do it, but then he's gonna tell you this is what you should do when it's bothering you.
Yeah, I mean, I know you've asked me questions. Well, should I go do this tournament? Should I go do this thing? And I always tell you the same thing. I don't tell you yes or no. I said, well, is it worth it to you?
Yeah.
I mean, here's your risk. Could you get hurt? Sure. Here's your risk of irritating this injury. If it's worth it to you, I'm not going to tell you to not go. I mean, it's up to your body. You're the one that's got to live with it. So, yeah, I mean, I tell people all the time, I'm not the one in pain, so it doesn't matter to me.
Look out for Dr. Krol on the mat, too. He plays it like he's not that good, but he's a strong motherfucker. He's strong, dude. You were pushing those guys around. They're both bigger than you. Dakota's bigger than you. I think Danny is, too.
He said he was about 185.
Everyone that said, add 15 pounds, whatever anyone says. That's how it works in the gym.
It's like subtract $10,000 a year from whatever people tell you they make when they do the job.
Yes. Yeah.
Oh, I'm making like $65,000 a year. Okay, you're making $50,000. That's
yeah.
Cool.
Exactly. It's the same thing. He's big. He's heavier than you for sure.
Yeah.
I rolled you both today.
He's pretty strong.
Yeah. I didn't roll you both today. I rolled him today, but I roll you all the time. Mm-hmm. So I know how heavy you feel. You're strong too.
Sometimes.
He's got good judo though. He's got good trips.
Mm-hmm.
And you held him off. And I don't know what Dakota was doing, but you mounted him pretty easily too.
Yeah. Sometimes I blind squirrel thing.
Right. And to be perfectly fair, Dr. Krol has some medical issues, so when he rolls for a little bit, he gets pretty loopy.
Yeah.
And he handled it pretty well today.
Yeah. I get that blood pressure drop, and I run into some problems, but they're going to be there whether I train or not, so I might as well train to some degree.
Right.
The best I can.
Yeah, I could definitely see it. Both the sweeps you gave up that I saw were both when you're like sitting there like, I can just see in your eye, like people think you're tired, but I know you're not tired. You're like, whoa, I'm about to pass out.
Yeah, and it's the same thing I would tell any of my patients. Just do it to the best of your ability.
Yeah, and Herbert said you look pretty good, so that's I took that as a pretty good compliment.
Anytime Herbert gives you a compliment, that's a good thing.
Yeah, I don't know. He might have just been being nice, so I'd roll with him.
Maybe. No, Herbert seems like a pretty straight up dude.
Yeah, you tell me if you suck.
I like Herbert, and yeah, that's the one thing I like about you is if I'm terrible at something, you'll tell me it.
That's pretty good.
Yeah. What did I tell you? If it's not bad, it's not good.
Yeah.
Yeah, that's not too bad. Okay, I know what that means.
Yeah, if you ever hear that's not too bad for me, it's not very good.
No, it's not good.
If there's no good in it, no good in my sentence, it wasn't very good. With that, we're going to get out of here.
All
Caveman's Corner from North Buffalo Studios. Dr. Krol's in-house, giving up a great, lecture, maybe.
Just chatting.
Just
good
chatting
chat about stuff.
It was almost a lecture.
I'm lecturing this coming week a couple times.
Yeah, if you can go see a lecture, man, I would. That one time I sat through your lecture, I learned a whole bunch. I would definitely love to sit through one of your lectures.
I do lectures at DUville and UB for their graduate programs for different things. I teach adjunct at Buff State. I teach anatomy and physiology. I do some stuff for the diabetes prevention program at the YMCA, and I do some stuff for Erie One BOCES for their vocational program. So I get around and teach at a whole bunch of different levels. So I really like doing it. I'm getting better at it. I think I'm pretty good, but I can always get better. It drives me nuts when I give a presentation and I go home and I'm like, man, I could have done better. And then I blow it up and I do better next time.
Are you familiar with Jordan Peterson? He's a psychology teacher. He's a big name now because he's against political correctness and social justice warriors and stuff. So he made a name for himself. But he has a ton of YouTube stuff. Just him lecturing.
Cool.
It's super fascinating. And he's trying to start like an online educational series.
Nice.
And maybe something like that for you too. That's a good idea to get your name out there too.
Yeah.
If you could do it.
Yeah, but it's something I like doing, so.
Yeah, definitely put it on YouTube, man. Try and get some cash out of it.
There you go.
All right. We're out of here for real this time. North Buffalo Studios, Caveman's Corner. Dr. Krol's a guest. We're out of here. Wasn't too bad.
Wasn't too bad. I'm always leery of the hot mic. The Caveman's extras.
Caveman's extras. That's the Easter egg.
There you go.
Yeah, you did awesome today, Roland. I was impressed.
Thanks.
Yeah. Dakota's gonna think he's good now and got that bullshit sweep on you.
Yeah, it's okay. Don't matter to me. Hey, the way I look at it, if your opponent voluntarily stays in there with you, then you get what you get.